To Stanford, California, where thousands of nurses have traded in their scrubs for protest signs, joining the picket lines after stalled negotiations with their employer, Stanford Health. Since April 25th, nurses have lined up outside Stanford hospitals in Palo Alto, California, calling on management to boost wages, address staffing shortages, and provide workers with more mental health support, issues that have been around for decades, but have only grown during this pandemic. Joining me now is Stromberg, a registered nurse at Stanford Health Care's radiology department, and the vice president of CRONA, the labor union representing nurses from Stanford and Stanford Children's Hospital. Ms. Kathy, good to see you. Thank you for joining us here on ABC News Live.
Good afternoon. Thank you for having me.
So Stanford Healthcare is cutting off health benefits on May 1 for nurses who continue striking. What does this mean for you and others in jeopardy?
What that means is that it makes the fight even more personal for us because we know that we will be without medical benefits, that we will not only be not providing care to patients, but some of us will have trouble seeking it for ourselves.
And many of these 5,000 plus nurses on strike worked at Stanford during the last walkout back in 2000. Having worked at Stanford for the last, 19 years yourself, what are some of the top issues nurses are dealing with, and why haven't things improved in the last 2 decades?
Well, I think it's a very cyclical thing, and we're at a different stage than we have been for that entire 20 years. The issues that we're having now are issues that nurses are having across the country. They were long-standing issues. They existed before the pandemic, but they have been intensified, magnified, brought to the forefront by all of our experiences through the pandemic.
And amid these contract negotiations, we know that things can be delayed, including surgeries, procedures, some patients access to things like chemotherapy. Not only have they been delayed, but some have been canceled altogether. How do you explain the stand you're taking to those who may miss out on care because of it? What do you say to their families? And what's the hospital's plan here?
Well, from what the hospital told us when we told them we were going on strike was that they were going to be able to bring in sufficient numbers of skilled, qualified replacement nurses to take our places at the bedside. And we have no part of their contingency planning, so we do not know what arrangements they ended up making. We don't know to the extent that anyone's procedures, appointments, or surgeries have been canceled. We do know that what we stand for in terms of nurses is that our goals are to make the care environment better for everyone, not just for ourselves, but for our patients. We want the people that are going to be taking care of you when you're in the hospital to themselves be healthy, because we think we will be at our best to provide our best care when we are healthy ourselves.
And let's talk about that,
things
because
like mental health support, safe staffing, It all ties into it. I'm sorry, I didn't mean to talk over you.
No, I think we're about to go in the same direction, which let me point out that a 2020 study from the University of California's San Diego School of Medicine found that male and female nurses are at higher risk of suicide than the general population. Please talk about how the pandemic has impacted your mental health and what needs to happen for things to get better.
Well, it's impacted a lot of our mental health significantly in terms of having to initially go to work when we didn't know how COVID was even spread. And the worry for not only ourselves, but our families, for bringing COVID home to our families. The stress of having to be the sole support for patients who are hospitalized and not able to have their families with them because of COVID concerns, the strain of seeing how it impacted people, and the grief that we experienced over so much suffering and death that so many of us have seen. And then during the pandemic, finding that when we reached out for mental health, that it was not readily available to us, using our employee assistance program and finding out that it would be 6 weeks to months before we could speak to somebody. We lost one of the travel nurses who was working with us in the intensive care unit back in January. He left mid-shift and was later found in an apparent suicide. And now, just this week, we have another nurse at a local hospital to us where a nurse is now deceased from an apparent suicide as well. So those are issues that are right at the front of our minds right now.
Wow. Wow, just really tragic to hear that. All right, Kathy Stromberg, again, registered nurse at Stanford Health and representing the union CRONA. We appreciate your time today. Thank you.
Thank you so much for having me.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.